Welcome. My name is Catherine Jones, the ICANN Leadership Development and Support Coordinator with the Campaign for the Fair Sentencing of Youth, and a very proud member of the ICANN network made up exclusively of formerly incarcerated juveniles that had extreme or life sentences all across America. I was 13 when I was sent to adult prison in the state of Florida, and I was 30 when I came home. And when I came home to a world that was unknown and foreign to me. The only thing that I had was a desire and a motivation to help those that I left behind, to use my voice to make a difference in the criminal justice system. A passion that is shared by my fellow ICANN sister, our guest speaker today, and fellow fierce advocate, Laura Berry. Laura, thank you for being with us. If you'd like to take a moment to tell us who you are, what you do, and what motivates you to do what you do.
Hi, my name is Laura Berry, and I am a proud member of ICANN, and also ICANN Regional Connector for the state of Arkansas. I went to prison at the age of 17, and I spent 32 and a half years. I came home in December of 2017, and the stumbling blocks that I came across upon entering society powered me to start my own group called the 539ers in honor of Act 539 that allowed for juvenile lifers in the state of Arkansas a second chance. And that group was started solely to provide mentors and help for other juvenile lifers that would be following me in this journey of returning for their second chance. I also am co-chair for In Solitary Confinement for Decarcerate.org, which is an Arkansas organization that fights to make positive changes in the Arkansas Department of Corrections.
Wow, Laura, speaking with you, I've learned of some of the amazing things that you have been doing during this COVID-19 crisis in your state, and that personally you've invested your time and energy to helping those that are currently incarcerated. Do you want to tell us a little bit about the status of the incarcerated during this pandemic?
Currently, we have 1,969 Arkansas inmates that are positive for COVID. Our main breakout was at the Cummins unit, which was over 90% positive. And in the beginning, it was kind of like an ignored situation. So several people combined from several different groups got together, and we started working to not only draw attention, but to get them the medical care they need and the emotional support, transparency to the family so that they would know what was going on with their loved ones. And in saying that, I would like to say the Poor People's Campaign, Arkansas Coalition to Abolish the Death Penalty, Arkansas Justice Reform Coalition, Seeds of Liberation, and the organization that I am proudly employed by, Incarcerated, in the state of Arkansas. As I said, we started out with all of our COVID cases at the Cummins unit, and we lost at least 5 gentlemen who were serving life sentences that were no longer a threat to society and could have very well have been released and be leading productive lives. We have a total of 11 deaths. I do not have an updated count on how many we have on ventilators. COVID has now spread to a significant number at 2 other units, but still not as many as we have at the Cummins unit. On Monday of this week, we led a peaceful protest at the Arkansas State Capitol, where we made a list of our demands to the governor, and I hand delivered with the support of all of these organizations to the governor's office in hopes that we can get some positive change for the people that are currently going through this fight of COVID in a environment that is a lot harder to remain safe than those of us who are confined to our homes. If you would like to see a list of our demands in hopes that that will give other people an idea in their states of what to, start asking for to help these individuals in all of the states that are fighting this right now, a list of our demands is available at thepeoplespressconference.com.
Thank you so much, Laura. This hit home for me about 3 weeks ago when I was contacted by a woman that I was formerly incarcerated with, and she advised me of the dire situation at the prison in Florida, Homestead Correctional Institution, where I grew up, where big lifers that were there embraced and raised me, nurtured me, and many of those were positive with COVID. And most of the positive cases there are women who are serving life sentences, mothers, aunts, sisters serving life sentences that went in their late teens inside of the prison to their early 20s and are now elderly between the ages of 60 and 75, that if they were released, they would not be a threat to society. This is an epidemic that is causing people that don't have life sentences to technically be sentenced to possible death sentences because they don't have any relief. So, as I said earlier, this is personal, and I know it's personal for you too, Laura, because we know what it's like to be in there and to feel like you don't have a voice, to feel as though there are no options, and truly there aren't. So some of the gentlemen in the prisons in Arkansas have been writing to you and telling you about the conditions and how they're handling this COVID crisis. And I would love to hear some of their words. So hopefully those that are watching this video could understand exactly how they feel and exactly what's going on.
Okay, so I'm going to read a couple of things that I received from a current juvenile lifer who's going up for parole soon. And he says, I'm starting to heal. Truthfully, I feel very fortunate. A lot of men here are still very sick. As you know, some have died. I'm very angry for the lack of medical care and how they have been treated. Some of the men that passed away were friends of mine. One man from my barracks here has been living in a holding cell for the past several weeks. He is so sick, he has to be monitored 24/7, but he's sleeping on the floor. I hate to say it, but people are being bullied. I have to watch people who are having their food stolen because of the food shortage. People are starving, and if we ask for help, there's hell to be paid. We had one gentleman who needed help and asked for his insulin. He was shot in the face with a rubber bullet.
One of the lifers who is serving time in Florida prison was a woman I referred to as Auntie. He had a life sentence for trafficking, nonviolent charge, served over 30 years and is now 65 and currently in pretty bad shape due to contracting the coronavirus. And her daughter posted a post on Facebook that really resonated with me. And she said, I don't want my mother's first steps after 30 years in prison to be in a body bag. And to think that I can't think of any justifiable reason for her to still be incarcerated at 65 years old. Really not a threat. And I think that's the case of most people who are serving life sentences. Many of them have served 20 plus, 30 plus years. have had the time to grow and develop and mature and rehabilitate, yet they are still required to remain inside of prisons. I see these releases of these ex-politicians with these white-collar crimes out of fear that they'll contract COVID-19. And then I think about all of the women, the amazing, phenomenal, talented women that I was incarcerated with, that because of them and the love that they invested in me, I am the woman I am today. And to think that they will not be granted that same opportunity given to those that have the financial means, the political status, to be granted freedom because they're forgotten or deemed not as valuable. It breaks my heart. And it's personal. When we went through the list of names that were sent from inside the prison of the people that were testing positive and that were not doing well, I knew almost every single one of them because they were lifers. Lifers that had been there when I was there 20 years ago as a child and helped mold me and raise me. And so this is very personal. And I know you feel the same way, Laura.
I do. Many of these gentlemen, even though I haven't met them, I've met their families. I've met former juvenile lifers that were friends and were mentored and raised by some of these gentlemen. Having been sick in prison myself and fought for my life for 4 years before I got the medical care and having almost died from it, I know personally and feel what they're experiencing, not only in the pain of their illness, but also the mental and emotional turmoil it takes on them every single day, that they don't know if it's going to be their last and if they're ever going to be able to walk out of those prison walls and have a second chance. On the same hand, I know how the families are feeling because I watched the struggle with my mom and my attorney and the people that cared about me and how they struggled every day, not knowing if I was going to live for another day, not knowing how I was doing at the time, not being able to see me. So it's a very personal thing for me because I experienced it, I lived it, and those are the people that, whether I knew them personal or not, they mentored somebody that was a youth that entered their prisons in their well years. And as Catherine said, most of them are in their 60s or older now. What harm do they pose to society in today's world?
And speaking of having a near-death experience, I remember my own. And, I remember calling my grandmother and telling her that I wasn't going to make it out. I was probably about 17 years old. And I said, Mom, I'm going to die in prison. I'm not going to make it home. And I can imagine what she felt, knowing that there was absolutely nothing she could do but to keep calling and asking them to give me medical care. When people inside say that they get only Tylenol and salt water, no matter what their ailment is, people that have not experienced with that would say, no way they're not negligent. No way is their medical care that inadequate. But us as people that were inside can affirm what they're saying and say, yes, in fact, that's exactly what they tell you. I've had a sprained ankle and received salt water and Tylenol. I've had the flu and received salt water and Tylenol. I've had a sinus infection and received salt water and Tylenol. So to hear that there's not even any more Tylenol, that means there's nothing but salt water, because there's no other medical treatment that is available there. It was very rare to get antibiotics, to be transferred to outside medical for an IV. They don't have up-to-date technology to put 700 people on ventilators. So that's where I think our responsibility comes. It's because the people that have never experienced it can experience through us and our stories. And that's what drives us and motivates us to do the work that we do, to be the voice for the voiceless. So thank you, Laura, for such an amazing conversation. And um, if you don't mind sharing, how have you come to terms with those same feelings of helplessness?
Actually, my fighting for the people I left behind, the women who raised me, the mothers, the brothers, the fathers, the daughters, the sons, the aunts, the uncles, you know, stop and ask yourself this one question. Would you rather be seen as the worst mistake you ever made in your life, or would you want to be seen for the positive changes you've made in your life? And when you have the answer to that, then that's how I ask you to look at each and every man and woman that's still behind those walls today.
Thank you for that, Laura. And I think something that people may not think makes a huge difference, but it does, is to contact your local legislative bodies, write letters of support, um, make demands of them, demand the releases of our incarcerated brothers and sisters that no longer pose a threat to society. Stay informed. Go on the Campaign for the Fair Sentencing of Youth website for information on the work that we're doing in response to COVID-19, incarcerate.com. Change Comes Now is donating supplies directly to the prisons in Florida. There are many, many more organizations. Look them up, research it, get involved. Thank you so much, Laura, for your time today, your willingness to be vulnerable, and thank you all for watching.